Greetings. Today I will discuss facelift surgery and its elements, including neck lift techniques we use for some patients but not for others. A facelift is primarily moving forward as our population ages. In the coming years, it will be performed more frequently and you will request it more. Thus, facelift surgery should be done well by plastic surgeons, because our society is aging rapidly. Now we have different methods for facelift surgery. Some doctors do short facelifts while others focus solely on skin tightening. There are truly numerous techniques available. Among these techniques, I particularly enjoy using the SMAS technique. It's more natural and the results endure longer. Therefore, today I will roughly discuss facelift surgery performed with SMAS techniques. So, what do we do in this procedure? We assess the patient. We noted sagging in the cheeks. The jawline is distorted and there are sagging spots. The neck shows looseness and sagging in the chin area. The midface has sagged down. We will lift all of these areas. How will we do this? We will start right here in front of the ear. We will start from here, following the natural curves and moving behind the ear to finish the procedure. Now we will first raise the skin as one layer. After we lift the skin, there's a tissue called SMAS underneath, as I mentioned. This is essentially a strong tissue formed by muscle and fascia beneath the skin. We raise this tissue similarly to how we lift the skin. We lift it as a tissue over the salivary glands from the underlying layers. We use this SMAS for tightening, pulling both sideways and upwards. We achieve this by also lifting upwards to counteract the effects of gravity. We lifted it up like this. We have pulled part of the SMAS. To support this neck area, the double chin, and the jawline we refer to as the jowline. We stitched it to the fascia behind the ear. We tightened it. After that, we'll remove extra skin. We're moving you. Our goal here is to bear the heavy burden of tension. To be able to do it with the pressure below, we don't want to overload the skin. After removing enough skin from the surface, we close all the cuts we made with self-dissolving aesthetic hidden stitches, eliminating the need for stitch removal, not needed. You're a guest here tonight. During this process, we are applying cold treatments and cold compresses. The next morning, we will see you and discharge you. Swelling and redness here rarely cause bruising. It will take about a week. In about 2 weeks, you will have returned to your work and social life. The complete recovery from the surgery will take about 1 to 1.5 months. Sometimes we think about facelift surgery. We can add upper eyelid aesthetics. We can also add lower eyelid aesthetics. And I often focus on the line that descends from the side of the nose, especially for these lines. For patients with less prominent cheekbones that are flat and indistinct, I enjoy adding a small fat injection. Facelift surgery is one of my favorite operations. The outcomes are lovely and natural, and it makes your faces smile.